You know, breast lift is a great operation because it can restore a breast to a beautiful shape and a beautiful position. But there are some drawbacks. A lot of techniques essentially just consist of removing skin, tightening it, and that works for a while, but then the skin in a stretched out breast has really lost its fundamental structure. So with time, basically what's going to happen is the breast is going to settle back down. And as that happens, the upper part of the breast gets very hollow, which is exactly what you're trying to correct with a breast lift surgery. So for this reason, a lot of plastic surgeons almost routinely will put implants in when they do a breast lift. And that's all fine and good if a person wants more volume, but many of our patients really don't want more volume, and they may not want implants. Well, fortunately, there is a good option for that for many, but not all patients, and that's what I call the structural breast lift. And basically with that, I'm taking tissue from the lower central part of the breast, flipping it up and under to volumize the upper part of the breast. And so it's almost like a living breast implant, and then the area that surrounds that on either side comes together, so you've got this pillar, and that restores your breast structure. So now the breast is anchored at several levels, and it tends to hold its shape, and it has natural living tissue to give beautiful volume in the upper portion of the breast. Now sometimes if a woman wants just a little more volume, we can do a little bit of a liposuction and do a fat transfer to augment that. One of the tip-offs can be when a woman comes into my office, wants a breast lift, and she says, you know, I'm happy when I'm wearing a bra. The breast is just exactly as I want it to be. It's just that I need to move it. Well, then that person's telling me they're a great candidate for a structural breast lift.